rapidly evolving and expanding treatment landscape, discussing presbyopia solutions with patients is becoming an increasingly nuanced task. In this episode of Presbyopia Unlocked, Dr. Neda Shamie leads a panel of experts, featuring Drs. George Waring, Walt Whitley, and Marc Bloomenstein, in a discussion of some of the products that can help manage early presbyopia, and how to go about educating patients at varying stages on the treatment options available to them. Coming up on this episode of Presbyopia Unlocked.
Hi everyone, my name is Neda Shamie. I'm a cornea, cataract, and refractive surgeon in Los Angeles and a partner of the Maloney Shamie Vision Institute. I am honored and delighted to be here for this latest episode of Presbyopia Unlocked entitled Discussing Presbyopia Solutions with Patients. I have a wonderful group of colleagues and panelists here who are going to add to the breadth and the value of this discussion, and I'm going to hand it over to my friend and colleague, Dr. George Waring, who can introduce himself and then pass it on to the next wonderful panelist here.
Well, Neda, thanks so much for having us. I'm just thrilled to be on with this rockstar panel tonight with Drs. Whitley and Bloomenstein and Dr. Shamie. I mean, this is just a great group. It's George Waring from Mount Pleasant, South Carolina. I'm a presbyopia surgeon. I'm also a presbyopic surgeon, so I'm a little bit redundant, but I also have compassion for the people that I fix.
Wonderful. And Walt?
Hi, everybody. My name is Walt Whitley, and I'm an optometrist at Eye Care Associates of Nevada in Sparks, Nevada, and I am presbyopia, just like Dr. Waring.
I wonder if that was the unifying theme between the four of us. Huh? And then we also have my friend Marc. Marc, please introduce yourself.
Thanks, Neda. Dr. Marc Bloomenstein. I'm like Walt, an optometrist out here in Scottsdale, Arizona. I guess I need to say I'm also a member of the club. I'm an MOP, member of the Presbyopia Club. I practice at Schwartz Laser Eye Center. We do a lot of comprehensive exams, but a lot of what we do is just cataract and refractive surgery. So, yeah, presbyopia has been something we've been dealing with probably since the beginning of time. So it's exciting.
Exciting and sad at the same time, but thankfully we have solutions. So exciting, and we're going to talk about some of those solutions and how to really discuss becoming a member of this club with our patients. So our club has about 1.8 billion members. As you all know, this is a study, and the huge demographic of patients are suffering from presbyopia, and we're new members of this club, and we feel for them. And these patients, as we all know, as we can talk on our own experience, are unhappy with their vision loss. With a survey of patients actually done and sponsored by Allergan, showed patients between 40 to 55 years old, 96% of the respondents claimed that at least one daily activity is somewhat affected by presbyopia symptoms, while nearly half of them said the impact is extreme, and often this is their main visual complaint. Let's see, Walt, do you see this in your practice?
Yeah, we see this daily within our practice. So I'm in a surgical practice as well. We do a lot of cataracts and refractive surgery, and we have a lot of patients that are coming in. Let's say they've had refractive surgery before, and then maybe in their 20s and 30s, and now they're getting a little bit more mature, like in their 40s now. And so they're noticing the difference, and they're thinking they need an enhancement, or they're looking for a way to improve their near vision. And so that's just one of the patients that I saw today. In addition to, just like you all, a lot of our cataract patients afterwards, the pseudo fakes, they're seeing better in the distance, but they're still wanting improvement in near vision. And so this is something, it's going to affect 100% of people. It's inevitable. Presbyopia happens. And I'm just excited that we have so many solutions now that we can offer our patients.
No, absolutely. And George, I'm sure you're also seeing in your highly surgical practice, and you work a lot with patients on optimizing their vision and their use of their eyes. Can you comment on what you're seeing in your patients?
Sure. So, Walt said it well, and Marc said it well, and we practice what's called vision for a lifetime, and so our eyes mature through different stages of our life, and so we're always setting the stage when we do LASIK, whether it's in their 20s or 30s, that they are going to have another stage where we're going to be fixing them, and so we're just sort of priming the pumps educationally to let everybody know to expect it, and it's amazing how well that's received. And we have a practice that is really specializes in the correction of presbyopia, and this is something that whether by word of mouth or marketing, people come just for the correction for age-related blurry near vision. And so this is a large part of our practice. In fact, when combined, if we just look at in the framework of dysfunctional lens syndrome, at least 2/3 of our patients, which would include cataract, but are choosing presbyopia correction throughout their journey. And that's whether this is just for stage 2 dysfunctional lens, stage 1 dysfunctional lens, or stage 3. So at all stages, that's sort of the idea, is that we're restoring their vision like they were children.
Yeah, and I absolutely agree with you. I mean, we were talking today, out of my surgical consults today, I had 30 surgical consults, and out of those 30 today, 3 patients only complaint or only diagnosis was presbyopia. These were 40-year-old, 20/20 at distance. For the first time, they're having trouble with their vision, and their chief complaint is that they can't see their close-up as well. And there was no cataract, no other issues. And, we've now been very used to talking about presbyopia correction in our cataract population of patients, but it's that interim patient that we were kind of the 40-year-old that we really didn't have great solutions. And now they're coming to us with these complaints, and thankfully we have wonderful options. And, their value add to a practice. I think a lot of surgical practices would maybe consider, I'm not sure if this is a problem in my practice, but just from my 10% of patients today were presbyopia patients. The question is this something we want to talk about? Or are these value added patients? And Marc, what are your thoughts on, presbyopia patients, and not so much the cataract patients, but the 40 to 50-year-old who doesn't have other pathology going on and their main complaint is presbyopia? How do they add value to the practice?
So Neda, you brought up an absolutely salient point in the perspective of adding a value to the practice is 50% of all presbyopes have never had an eye exam. There was a report that 86% of all patients that have bought cheaters or over-the-counter readers have never had an eye exam. So these are patients that actually aren't even going into our offices looking for a solution, but yet, as George had said, with dysfunctional vision, and as Walt had said, the exciting solutions we now have, I think it's imperative for us as eye care clinicians to draw these people into our practices. And one of the ways to do that is by literally letting people know that we are here as eye care clinicians to help them, keep that continuous vision. The interesting thing for me is that, especially in an optometric practice, we really didn't talk about presbyopia that much. I mean, it was patients are upset about it. They're saddened. It's a harbinger of old age. And all we could do is offer them, maybe a monovision contact, or we could offer them some progressive lenses, which most people really didn't want hanging at the end of their nose. And now, as we've seen with extended depth of focus, or we've seen with the trifocal lenses in surgery, and now we've seen with pharmaceuticals, we need to start talking to patients and get them excited about this, and also bringing them in to make sure they're great candidates for some of these newer solutions. So there's a huge value to, it's a win-win for the patients as well as for our practices.
I think that's a really great point. And, it's interesting, the previous generation of presbyopes, the 40-year-olds who are now, in their 60s now, the 40-year-olds back then, when they became presbyopic, they just followed suit what their parents did and went and bought the, $10 reading glasses and just kind of expected that this is going to be part of the aging process. Today's 40-year-old is the 40-year-old of the Botox era, where, our era, we don't want to age. We don't want to let the natural aging process necessarily creep in as fast as it does. And I think we're much more amenable to looking for solutions to be able to keep our active lifestyle and not have to give in. And so, George, I'd love to hear. I mean, you always have such wonderful ways of explaining things to patients. And how do you explain presbyopia to a 40-year-old who comes in and wants LASIK done, wants a surgical solution for their need for reading glasses? How do you explain how that works? And do you mention lifestyle adaptation as a way to demonstrate to them what presbyopia is?
Well, it's interesting. Like you, Neda, we had a number of patients over the last weeks that had presented for presbyopia correction in their early to mid 40s, who were 2015 at distance and J2 for reading, and were just maybe had noticed that they had lost a line or a line and a half of reading vision, and these are tricky patients, and that's your true plano presbyope, or what we like to talk about in terms of almost stage 1/2 dysfunctional lens, or the very mild presbyope, and really it's almost incipient presbyopia. But people are picking up on it, and they're saying, "Hey, something's wrong, and I don't want to age, and I want to fix." Now, it's a completely different story if we're talking about congenital emmetropes, that we're going to be fixing their congenital refractive error. And that's how we talk about this. We frame it in terms of congenital changes, and we don't use these fancy terms. You say, hey, LASIK really is designed to fix problems you're born with, but not necessarily age-related issues. And if we're further down the continuum, say hyperopic or stage 2 dysfunctional lens, then we talk about a lens-based procedure. But if we're the patient you described, Neda, who's 2015 J2, then we talk about drops, and or we talk about fixing their congenital issue, the problem they were born with LASIK, and then we can use drops also. So we're really kind of moving away from blended vision, because that's the most difficult discussion that I have, is trying to talk about to the early 40-year-old about blended vision. So we talk about it, we offer it, we do it, but now we have this other amazing opportunity with presbyopia correcting eye drops, such as Vuity, first in history in the market, and where we can really focus on giving them stereo distance acuity with and maintaining their depth perception, and then adding a drop as well. And that's really smoothed the whole entire conversation out tremendously.
I absolutely agree with you. And I think looking at that continuum is really important, because, as you said, the LASIK patient who was a myope and understands the value added of having a procedure that improves their vision, and they have now gotten accustomed to not needing glasses, is entering the presbyopia eye, will probably be much more responsive to opportunities to get out, keep staying out of glasses, such as using eye drops. And again, Vuity being the first such drop available to us. And it's been a wonderful addition to our surgical practice in those patients who had LASIK before, who are now coming back and saying, it's worn off. Can you fix my LASIK again so I can stay out of glasses? Well, those are the patients who are presbyopic, would do really well with the drops. And it really is kind of a bridge to the next stage, which is when they develop cataracts, you are giving them the solution of staying out of glasses throughout the spectrum of their lifespan. And so when time comes for cataract surgery, it's not like they've gone back into reading glasses where they say, well, it's okay, I can stay, I'm fine with readers. But in that case, if you've done drops and you've created a bridge, when time comes to talk about cataract surgery and presbyopia lenses, that conversation is kind of a build on what was previously done. Now, Marc, are you finding that, again, the drops are helping bridge those two groups of patients, those before who are emmetropes, and you're correcting, as George was saying, kind of congenital, what you're born with, versus the cataract patient, and how are you fitting the drops into your practice?
So it's interesting because in the very short amount of time that this drop has been out, it's like every single time I go into a lane, I look and I think, is this somebody who would be interested in learning how to navigate their phone or computer or be in a dark environment without having to put on glasses? And I've yet to find a patient who is over 40 that I don't think would be a perfect candidate to utilize, Vuity, as George mentioned. In our practice, those pseudo fakes who basically got a standard IOL with no correction. I know it's kind of an off-label use of it, but those patients love utilizing the Vuity. My status post-refractive patients, like George had talked about, moving them straight out of those patients, your consults you were talking about. I actually had a patient today who was a monovision patient. She had monovision. She's 20/20 in the distance. She's about J1, J2 up close. And she said she's just having a little bit of a hard time basically putting a needle in a child's arm. And she said, I heard about these drops. Do you think they would help me? And I'm like, you know what? I think there's a great opportunity here to maybe either utilize it in your distance eye to improve more close vision while still maintaining good distance vision, or maybe in both eyes. So I'm excited to see how many different opportunities we have to be able to utilize a drop that lasts 6 to 8 hours, basically. If a patient loves it, they stay on it. If they don't think it's going to help for them, then you know what? Nothing ventured, nothing gained.
And what's amazing, I think, about Vuity is that you can trial it. You can try it even in the office. It takes about 15 minutes to take effect, and the patient can have that experience. And the fact that it's reversible or titratable, meaning they can use it when they feel that they need to on the days of the week that they need to. This is really causing a paradigm shift. It is a very exciting addition to what are offering to patients. Now, Mark, I'm a little concerned about, did you say your patient was a nurse, I hope? Putting a needle in a child's arm. There may be more problems there.
No. She's absolutely a nurse.
Okay,
yeah,
good.
but I checked. When she said that about the needles into kids' arms, that was my first thing too. So
okay, good.
Thanks for catching that.
So, Walt, I'd love your thoughts on this. I feel like the Vuity has helped me be a more thoughtful surgeon in that I'm not pushing the limits of surgical intervention to gain suboptimal benefits. And that's, for example, in the patient who has had LASIK in the past, and I'm trying to treat their presbyopia with PRK enhancement and monovision that's never perfectly optimized for that patient. Now I'm offering them Vuity, and in doing so, I gain that trust in the patient. The patient sees that as a surgeon, I'm looking at alternate ways of giving them the outcome they want in a way that's reversible, that's safe, and I could potentially really bridge them until they, for example, need cataract surgery.
Actually, I just had that patient you're talking about the other day, where she had refractive surgery many years ago. She's starting to get some early cataracts. She ended up being about plus 50, maybe plus 75. And just as Mark was saying earlier, looking at the different ways we can help our patients, I'm going into the exam room like, is this going to be a patient who would be a candidate for the presbyopia drops? And so I talked to her about it, and I said, hey, this is what it's going to do. It's going to help improve your near vision, but this can also improve your distance vision as well. And so she was super excited to do that. Just like you mentioned, doing the in-office trial, I'll do that as well, and I'll just write that script and send that in for patients. But with having the Vuity drops, it's an opportunity, as you all mentioned earlier, where it's not going to be necessarily one size fits all, but it's going to be an opportunity for us to offer other treatment options for our patients where they want to use it every day, fine. If they want to use it sometimes, fine. If they want to wear their glasses too, fine. But it's just a great option that we have for our patients. And I've been an excited user of it as well.
Yeah, I think I agree with you. And, the 40-year-old presbyopia, 40 to 50-year-old, obviously it's a no-brainer. It really is a really fantastic option for that patient. It's also a great option for the myope who finally has saved enough money to be able to afford to have LASIK, or because of COVID and mask wearing is frustrated with their glasses and is coming in for LASIK, but they're like presbyopic, or they're 40 years old, and sometimes they feel like they need extra light, or they can't, they may be pushing the limits of their arm. It's made me more confident offering LASIK to that patient group, because I say, the worry about needing reading glasses is less, because you'll be able to use this Vuity drop to be able to see well. So no worries there. I'm sure, George, you've seen that too. And how about your patients who are like 50? And how does this help, or how do you see drops or surgical options fitting in that older patient population, George?
Prior to the launch of drops and having access to this wonderful tool in our toolbox, Neda, we again really frame our offerings as those that fix focus problems that you're born with, and then other solutions that fix focus problems related to age. And so we really don't do much LASIK after 50. And of course, this is all relates and is directly related to their refractive status and their refractive error. With that said, we still do have 50-year-olds that are 2015 plano presbyope and still can read reasonably well. And that's somebody that we may have the discussion about drops, but usually they've really fallen in past the first stage of lens dysfunction and getting into the second, where we really are doing more lens replacement. And this has become a very large part of our practice. As we mentioned, we really have our center really is based and focused on the surgical correction of presbyopia. And so there's been a lot of word of mouth about this, and so that's really our happiest patients. But there's absolutely a niche because it's not a one size fits all situation. We customize this to all different comers, and but it's just such a wonderful time to be able to do what we do, because we have so many different vision correction options. But mostly 50 and over. We're usually doing a primary lens replacement for the age-related issue.
And do you think that, and I'll throw this out to anyone who would like to comment, and do you think that the discussion around presbyopia correcting lens implants will become a much more fluid discussion and easier presentation maybe in 5 years, after patients have become more accustomed to presbyopia correcting or presbyopia mitigating eye drops, such as Vuity, or presbyopia drops like Vuity, because they've gotten used to that staying out of glasses, and that glasses are not necessarily inevitable?
I think that just overall the discussion around presbyopia that we've been having for the last 10, 15 years, and now just having another tool in our armamentarium, I think it's almost going to become inevitable that we as clinicians start talking to our patients sooner. George had mentioned dysfunctional lens syndrome, and I don't know that, especially in the optometric community, that's a term that you hear a lot, but we talk about patients when you say, oh, you're starting to need glasses for close vision. And so it's like, these are now your options. This is what we're going to have. But as we age, and as that lens, loses its ability to be as flexible, and we start developing, cataracts, we'll have other options available to you. And I think, to your point, is getting patients excited about the fact that, look, we have these progressive lenses, we have these spectacle-based lenses, but then we also have these drops for the times you don't want to wear your glasses. But then when your lenses get to a point where you're ready to have them removed, we have these, multifocal or extended depth of focal or trifocal opportunities. So to your point, I think we need to start providing our patients early, letting them know about, this age-related change to their near vision, letting them know what the exciting options are, because I think they're just going to keep getting better. I mean, this is first drop that we have, first in class, and I kind of foresee there's other iterations that are going to make it even better. So I absolutely see this as a continuum for the technology for our patients.
And the discussion is going to grow. I mean, just looking at this series of discussions among colleagues, and we're doing just one episode of many around presbyopia, just goes to show you how much opportunity there is around this one subtopic in our field. And this may be a reflection of me being in Los Angeles, and West Los Angeles for that matter, where I keep really relating the experience we're having as ophthalmologists and eye care specialists, optometrists around presbyopia to the dermatologists and the plastic surgeons who went from really not having many options until facelifts or surgical intervention was needed to, Botox being the bridge to fillers, being the bridge to more surgical intervention. And the general public, at least in LA, they're very accustomed to that, looking for opportunities to address the aging process. They're not, people don't just accept it for what it is. We are empowered with opportunities and tools to address the aging process. And so I think, it's kind of interesting that Allergan is the first company that came up with the presbyopia. It fits the bill with Botox and again, tackling aging. What are your thoughts, Walt, on, again, the patients coming in? Do you think that soon enough patients will come in asking for this? And if an eye care specialist is not making the offerings, whether it's Vuity or presbyopia-correcting lenses, that they would potentially lose patients from coming into their practice?
Yeah, that's a great question, and I think it's once again a huge opportunity because yes, Allergan's the first one. We've already had patients come in and asking us about the drops, and we haven't done any promotion on it. They just heard it on one of the news segments, or maybe it was Jimmy Fallon's episode that he did. But people are starting to talk about this, and then we're going to see the different social media posts on this as well. And so this is just one company. And they haven't even started the DTC advertising yet. So when that happens, we need to start preparing our practices now. We need to start having that discussion now. I mean, you all mentioned education. We say 40s, but do we start sooner? Do we start in the 30s, say, hey, this is what we're doing now to help your vision, but in the next several years, these are some of the changes that you're going to notice. And that's where we have options such as the glasses, we have contacts, and we have Vuity as well. But then keeping that discussion, that education, it's a journey, and it's our presbyopic journey. And so going from the early treatments to the surgical corrections, I mean, we all need to be ready to, and our staff ready to have this conversation, because there's a whole lot of patients that Mark just mentioned that haven't even had an eye exam, using over-the-counter readers and wanting to come see us.
Yeah, and these are patients who are savvy, who are getting on the computer, looking and searching. And I think if a practice wants to capture the attention of these patients who have never seen an eye doctor, or who are seeking eye doctors who are up front with latest technology, latest advances in the field, it's important for our practices to, as you said, educate, whether it's through having content on your website or taking advantage of social media. It's a real value added to the practice. I know that initially my optometry colleagues and friends were hesitant about presbyopia drops because their concern was, is it going to potentially compete with their spectacles business or their just general practice? Ophthalmic surgeons were concerned, is this going to potentially impede my ability to offer premium lenses? But as we discussed in this last half an hour or so, it is truly value added. It allows for all of us to bring new patients in, engage the attention of patients, possibly at a younger age than they would come to us, for cataract surgery, for example, where they may have gone reading glasses off the shelf for years, and now they're coming to us and they're not interested in presbyopia lenses because they've gotten accustomed to readers. versus having that conversation, getting patients to understand that there is incredible value in not having to be reliant on reading glasses, and do that early. Educate them early, have them come into your offices for their exams sooner, and not getting, essentially presenting to them the idea that you're not going to have to rely on glasses. And when time comes for cataract surgery, that there are wonderful options to give you the best vision possible without the dependency on glasses. And as we all know, we're much younger, much younger at age 40 than maybe the previous generation 40-year-olds were. We're much more active, and we have bigger demands on our eyes and our life. So with all of you, I'd love to ask, George, have you tried Vuity yet? You said you're presbyope, so I want to know how did it work for you?
Neda, it worked great. I was pleasantly surprised. I noticed improvement. I had a little bit of redness for less than 10 minutes, which frankly I'll actually get with preservative tears. I noticed my reading vision improved dramatically within 10 minutes, and my distance vision improved also. I had some sense that I could feel that it was working for a brief period of time as I was kind of getting used to that a range of focus and with my pupil modulation. And I had no brow ache whatsoever. And it lasted for about 6 to 7 hours for me, where I was sitting down at the computer later that afternoon or evening, actually. And I recall the moment where I said, "Oh, it's starting to wear off a little bit. I wonder if I should take some more."
Yeah. My experience was very similar, and it most definitely improved my distance as well as my near. Actually, my near improved by 2 lines. So I'm much more of a presbyope than I thought I was. And what's been interesting is that we were able to get some samples, and it's just flying off the shelves. And it's incredible. Our staff have tried it, and they're just absolutely sold on it. It's the fastest kind of learning curve that I've had in educating my staff on a drop and its impact. They are so excited in offering it to patients and talking about it to patients.
Yeah, real quick, Neda, I'll actually have my staff is actually catching me and some of these client situations that have been described by Marc and Walt, and they're saying, "Hey, Dr. Rang, don't you think that would be a great patient for Vuity?" And I'll go, "Oh, yeah, you're right. Good thinking. Good job."
We have the exact same experience in our practice. I've used it. I'm a little bit of a low myope. I had no brow ache. I had a little bit of redness, but I've had other patients who've tried it, and their eyes were red. They got a little tunnel vision, a little brow ache, and they're like, "I don't know about this. I don't know about this." And about 20 minutes later, I would walk up to them. This is some staff members, and I'm like, "How are those drops?" And I go, "I didn't even think about it." I go, "But you're not wearing your glasses." And they're like, "You know what? You're right." So, I definitely think there's a learning curve. And for me, I didn't realize that they were helping until I put on my single vision glasses, and I'm like, wow, I can actually see my phone. So it's pretty exciting. I'll tell you that there is somebody in my office, and just to show the versatility of this really safe, efficacious miotic drop, she's an RK patient, and she only wears glasses at the computer. I know she's got astigmatism. She has tremendous amount of glare at nighttime as she's driving home. And she said, "What do you think?" And I said, "You know what?" I said, "I think it's worth trying." She is by far the number one advocate for this drop. She absolutely loves it. She sent me a text. She said, "I have no glare at nighttime. It's phenomenal. I can sit in front of my computer. I'm reading without glasses for the first time in like 10 years. So, I think your staff can be, like George just said, they can remind us of how well this drop can be for patients that we oftentimes don't even think about.
Absolutely. And Walt, I'm sure you can comment on the fact that it's reversible and you can trial it. And it's one of those things that it's quick acting. So you don't have to wait weeks to see the effect. It's within 15 minutes. And then if it doesn't work, it doesn't work, for the patient.
Yeah, I mean, we've seen that with our patients already. We just putting that sample in office, waiting 10, 15 minutes, and they're like, oh, wow, I could see already. So you're asking about experiences. For me, I thought I was more presbyopic than I was. Uh, but when I put the drops in, I was able to see a couple lines better than I was before. But toward the end of the day, I did notice that it did wear off. So I knew those drops were definitely working. I did not have any brow ache, headaches, or redness. And so for me, it's been very successful so far.
Well, thank you so much for sharing your experiences all. And to close, there's a lot of exciting options out there. Vuity most definitely has expanded our discussion around presbyopia by adding a bridge for our patients who are in that kind of early presbyope, but also in the kind of a subgroup of patients, as mentioned by Marc, that can be used outside of its indications. But also presbyopia lenses, the technology out there is exciting. There's so many wonderful options. And if a surgeon or an eye doctor is not engaging with these incredible options available, they are missing an opportunity to really make their patients happy, to bring in new patients, and really add value to their practice and their personal and professional satisfaction. I personally am loving being an ophthalmologist. It is, this is a very exciting era for us. And thank you so much for sharing your thoughts and your feedback on this. I'm excited to talk more about this. And again, great friends and great discussion. Thank you so much for your time.